according to a report from the World Health Organization. In humans, CBD exhibits no effects indicative of any abuse or dependence potential. To date, there is no evidence of public health-related problems associated with the use of pure CBD. A recent study in the journal Neuropsychopharmacology concluded that acute CBD alone is unlikely to significantly impair daily functioning or workplace performance. Phytocannabinoids are the naturally occurring cannabinoids found in plants. Phyto, meaning plant, are primarily found within the Cannabis genus. These compounds, such as THC, tetrahydrocannabinol, and CBD, Cannabidiol, are known for their diverse pharmacological effects and their interaction with the body's endocannabinoid system. In our last video we explored the mother of all cannabinoids, also known as CBGA. All cannabinoids evolve from this specific cannabinoid. The purpose of this series is to examine the most common cannabinoids found in today's market. Today that is CBD, Cannabidiol. As the cannabis plant matures, enzymes convert CBGA into other cannabinoids like THC and CBDA. CBDA then undergoes decarboxylation, a process often triggered by heat, to become CBD. CBD is found in higher concentrations in hemp than its cousin cannabis, which is often bred for its higher concentrations of THC. However, there are a number of cannabis strains high in both cannabinoids and by closely monitoring the growing cycle provide a nice balance. It is believed that CBD performs to its highest potential when combined with THC. As people are increasingly seeking alternatives to pharmaceuticals that may have harsh side effects, CBD research has expanded significantly over the years, much of it sponsored by the U.S. government, in conjunction with mounting anecdotal accounts from patients and physicians, shows that CBD has potential as a treatment for a wide range of conditions. In 2013, Dr. Sanjay Gupta, a medical correspondent for CNN, appeared in a documentary series called Weed, in which a young girl with debilitating epilepsy found significant life improvement through the use of CBD. This series brought national, if not worldwide, attention to this incredible cannabinoid. Although CBD has been applauded for a wide variety of health issues, its strongest evidence has been found for its effectiveness in treating epilepsy syndromes. Specifically, Dravet syndrome and Lennox-Gastaut syndrome, and tuberous sclerosis complex, none of which typically responds well to anti-seizure medications. Numerous studies have found that CBD was able to reduce the number of seizures, and, in some cases, stop them altogether. Epidiolex, being the first cannabis-derived medicine, was approved by the FDA in 2018 to treat these conditions. CBD has proven neuroprotective effects and its anti-cancer properties are being investigated at several academic research centers in the United States and elsewhere. Guidelines established by the American Society of Clinical Oncology conclude that patients undergoing cancer treatment who are experiencing nausea and or vomiting despite adhering to antiemetic prophylaxis protocols have found improvement when given CBD and are encouraging clinicians to consider adding dronabinol, Nabil-1, or a quality-controlled, oral 1:1, THC-CBD extract. A 2024 study concluded that the effectiveness of acute migraine treatments using a combination of 6% tetrahydrocannabinol, THC, and 11% cannabidiol, CBD, a ratio of 1:2, compared to a placebo performed better for relief at the 2-hour mark post-treatment. It furthermore concluded that the benefits of this treatment were sustained, with continued efficacy noted as long as 48 hours later. Increasingly, human studies are substantiating the claims that CBD helps control pain. One animal study from the European Journal of Pain suggests CBD could help lower pain and inflammation due to arthritis when applied to skin. Other research identifies how CBD may inhibit inflammatory and neuropathic pain, which are difficult to treat. Patients using CBD for pain state that they turned to CBD because more than 80% of their day was in some type of pain, most commonly from inflammation, arthritis, and/or fibromyalgia. Chronic pain issues also cause other problems including sleep problems, mood issues, typically anxiety and/or depression, hormonal conditions, PTSD, and gastrointestinal disease. Patients report meaningful improvement using CBD in the frequency and duration of their pain. Without CBD, the average pain score was 6.85. With CBD, the average pain score was 2.76, representing an average decrease in intensity of 60%. In light of the well-known dangers of opiates, this suggests that CBD has significant potential as a non-toxic, non-addictive pain therapy. Many of us, at some point or another, has had the experience of taking one medication to treat a problem, then having to add medications to our list to treat the side effects of the first medication. And if you haven't had that experience yet, it's a safe bet that at some point you will. At this point you may be thinking of the riddle, what came first? The chicken or the egg? Just me? Okay, let me explain. With few exceptions, each of the conditions CBD is being researched for are related in some form. We just learned that chronic pain sufferers report anxiety and insomnia, when CBD is also being researched for both anxiety and insomnia. The fact is nearly all of the conditions that CBD is being researched for and found to be helpful for, not only treat the condition but also the side effects of that condition. So what came first? The chicken or the egg? Anxiety and depression. Studies and clinical trials are exploring the common report that CBD can reduce anxiety. PTSD. Patients with PTSD are almost 3 times more likely to report using CBD for alcoholism and/or other addiction, and 3 times more likely to be using CBD for a brain injury. When asked to rate how CBD impacted 9 common symptoms of PTSD, CBD appeared to be highly effective in addressing a range of PTSD symptoms, particularly anxiety, anger, irritability, depression, mood swings, and panic attacks. Insomnia. Studies suggest that CBD may help with both falling asleep and staying asleep, in part by helping address chronic pain and anxiety. CBD can help lower cravings and withdrawal symptoms for tobacco, alcohol, opiates, methamphetamine, cocaine, and heroin under certain conditions, according to some research in humans. More importantly, research is finding that relapse is reduced, perhaps because the underlying causes of many addictions is being addressed as well. The list of conditions currently being researched include autoimmune diseases such as inflammation and arthritis, neurological conditions such as Alzheimer's, dementia, Parkinson's, multiple sclerosis, epilepsy, stroke, and traumatic brain injury, metabolic syndromes such as diabetes and obesity, neuropsychiatric illness such as autism, ADHD, PTSD, and alcoholism, gut disorders such as colitis and Crohn's disease, cardiovascular dysfunction such as atherosclerosis and arrhythmia, skin disease such as acne, dermatitis, and psoriasis. There are possible side effects from CBD use including nausea, fatigue, and irritability. Please be aware that if you are taking a blood thinner, an anti-epileptic, or an immunosuppressant medication, CBD can increase the level of blood thinning and other medicines in your blood by competing for the liver enzymes that break down these drugs. Grapefruit has a similar effect with certain medicines. People taking high doses of CBD may show abnormalities in liver-related blood tests. By higher doses we mean greater than 1,000 milligrams per day of CBD. Many non-prescription drugs, such as acetaminophen, Tylenol, have this same effect. Because CBD can be found in both hemp and cannabis, a significant safety concern with is that it is primarily marketed and sold as a supplement, not as a medication. Currently, the FDA does not regulate the safety and purity of dietary supplements, and no one, really, is regulating the hemp CBD market. Many hemp-derived CBD oil products are mislabeled as to cannabidiol and THC content. And poorly processed CBD oil may be tainted with toxic solvent residues, pesticides, corn syrup, artificial flavors and colors, and other contaminants. Hemp-derived cannabidiol is just a mouse click or a phone tap away for anyone willing to roll the dice and purchase CBD oil products that are manufactured with little regulatory oversight. Purchasing from legal cannabis markets, like we have here in Washington and 38 other states, requires extensive testing and ensures you are getting what it says on the package. CBD comes in many forms, including oils, tinctures, capsules, patches, vapes, and topical preparations for use on skin. Some CBD manufacturers have come under government scrutiny for wild, indefensible claims, such as that CBD is a cure-all for cancer or COVID-19. No drug is a cure-all for anything, and CBD is no different. Does CBD help a lot of people live a better life? Absolutely. Does it help everyone? No, it does not. So if you decide to try CBD, make sure you are getting it from a reputable source and remember that cannabis research is still in its early stages. Therefore, while progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions. Thank you for joining us. If you're still with us and willing to go deeper into the weeds of cannabinoids, as we continue to explore the most common cannabinoids found in today's cannabis market, hit that like and subscribe button, and leave us a comment. Until next time, peace.